Hi, everybody. Welcome to the latest episode of NottsPharmCast. And again, I'm delighted to say today that we're joined by two guests from NHS Nottingham and Nottinghamshire Talking Therapies. We have with us today Kashmira Gorecha and Martha Heighton, who are going to talk to us a little bit about the fantastic things they do. And they do loads of stuff. They were talking to me yesterday about all the things that they do, and I was absolutely blown away. So I will hand over to them both shortly. But if we can start, I think Mike Jones, I must say, is also here, our pharmacist and our services implementation manager. And I know, Mike, there's a couple of things that you'd like to say just before we kick off. So I'll hand over to you.
Yes, thank you, Kirsten. Well, hi, everybody. So today it's a real pleasure for us to welcome Kashmir and Martha from Talking Therapies to speak to us, especially about the support they can offer your patients as pharmacists and the benefits of their services. And it's a really important time as well, because very shortly at the end of this month, depression will be added as a condition into new medicine service, and we wanted to do everything we could or can to support you as a contractor to help your patients.
That's right.
The specification of the new medicine service has been updated with the addition of depression, and the criteria has been updated as well. And you'll have noticed that in the part of the criteria for completing the pharmacy quality scheme this year includes the completion of the CPPE module to support pharmacists to have conversations with patients with mental health conditions. The interesting thing as well is the new specification does recommend that pharmacists are aware of and signpost patients to other mental health professionals who may be in their vicinity. And we at the LPC really wanted to help get you ahead of this by providing this opportunity for Talking Therapies to talk to you all about what they can do. So, as I said, we wanted to help you with that situation by collaborating with the local NHS Talking Therapies to give you a head start, and it also helps you give your patients extra holistic care as well. So, without stealing Kashmira and Martha's thunder, we'll be learning more about that support from Talking Therapies, and what they can do to help you and your patients.
Brilliant. Thank you, Mike. I think let's go straight into it. And I'm looking at Kashmira here. Kashmira, can I ask you to give us, because I know you gave me a fantastic overview yesterday when we spoke, an overview of what you do at Talking Therapies, the kind of support it offers. Yeah, just give us an introduction. That would be fab, please.
Hi, Kirsten. Thank you for having us. So, as an organisation, NHS Talking Therapies is a free and confidential NHS treatment service. We're here to help with milder to moderate mental health disorders. The most common things that people present to us with are anxiety and depression. Mm-hmm. So anyone who's struggling with their mental health around anxiety, depression, stress, regular low moods, for example, can use our service. It is free. We are trained confidential staff as well.
Fantastic, brilliant. So who can use the service, Kashmira? Is it anybody and everybody?
Essentially, we work with adults, so anyone approaching or almost at 18 and above can use our service. We don't have a huge number of criteria. We just ask that you're registered with a GP somewhere in Nottinghamshire, and literally you can refer yourself, or a GP or another professional in the field can help do a referral for you. So like a health visitor or a pharmacist, anyone working with people in the field can actually refer through our systems, and you can also do it yourself very simply.
Okay, brilliant. So do you have a sort of a typical patient journey, Kashmira? I'm not sure whether you do, because we're all different, aren't we, at the end of the day?
We do. Well, our treatments are obviously bespoke depending on what the patient needs, but in terms of the process, we You do a referral, which you can do
Mm-hmm.
by email, by phone, over our website, which is the most common place to do a referral. The referral is submitted. It's literally a handful of minutes in terms of that referral. It's not onerous. There's not pages and pages of info that we ask of you. A bit of contact info. There's a touch on past treatments, medication that you may be on. You submit that. Within a couple of weeks, you'll have a suitability assessment. Usually that is done on the phone, so a good hour plus conversation, which is pre-planned. We don't call you whilst you're sat in the bus and go over your health history. We would arrange that with you. So a suitability assessment in terms of the context of what's happening for you. We build a big picture. We ascertain, are we the right service to give you support, or do we signpost you elsewhere? If we are the best service to help you, we would outline a plan of action, a kind of treatment plan with you, and we run through that with you, and that's when you're added to our waiting list. And once again, waiting list is $1 million question on the NHS.
Yes.
So we basically work to a 90-day waiting list period.
Okay.
So most people are seen well within the 90 days. Currently it's within 6 weeks, I think. And
Brilliant.
what we say is, if you're on a digital or online treatment plan, you'd actually be able to access that within a couple of weeks of being on our waiting lists. Some therapies are higher intensity, so there may be less capacity. If you're a patient that had access issues or some special circumstances that we need to kind of consider, there might be less capacity in that area, and it might take slightly longer. But to be fair, everyone is seen within the 90 days usually.
Okay. And you mentioned the sort of things that talking therapies can help with, Kashmir: anxiety, depression. Are there any other things at all? I know you mentioned the different sort of approaches yesterday as well. Could you tell me a little bit more about that?
Of course. So, I mean, it's not an exclusive list, but depression and anxiety are the most common things that we support. But in addition to that, we support GAD, generalized anxiety disorder, health anxieties, specific phobias, social anxieties, which is particularly a big deal with younger adults that we're finding since COVID. OCD, obsessive compulsive disorder, post-traumatic stress disorder, those people struggling to cope with daily life, a whole range of kind of different anxiety levels that we can support as well. So there is more information on our website, but what I suggest is that people just keep in mind we're mild to moderate, and most things that we will cover.
Okay. And I think I know you have a webinar approach, Kashmir, is that right? And I don't know whether Martha wanted to talk a little bit more about this. There is a webinar approach for patients.
Yeah, if you want me to just kind of go over what therapies we do
I was
offer.
just going to say, yeah, that would be fantastic. That was sort of next question. How does it all work? What are the next steps once you've got somebody engaged?
Yeah, so there's obviously lots of different types of therapies that people can access depending on what their needs are. We start with kind of we call them lower intensity treatment. So things like, you say, like webinars. So we offer webinars. They're really easy to access. You get loads of information out of a webinar. We have a few different ones. So we have managing worry, we have living with a long-term condition, which might be quite relevant to some of the patients that the pharmacists are working with.
Absolutely.
We have anxiety with an autism diagnosis, and we have managing low mood. So it's very sort of intensive, depending on what the person's coming for. Usually around 6 sessions, around an hour and a half. People can chat on the bot, but they don't need to have their face seen. They can sort of just listen to all of the information, get all the resources that they need. So that's one of the approaches. There's also a digital offer, which is Silver Cloud, which is like an online platform. So people will be given modules. So depending on what their presentation is, they can go away and do the work themselves. It could be the middle of the night and they need some tips on how to keep calm, or they need kind of to watch a video, or they want to do some homework, and that's just completely in their own time. So that's kind of like our lower interventions. We also can offer sessions with our psychological wellbeing practitioners, which are also kind of self-guided CBT support. And so that's where they'll give you homework to do, and you can have half an hour chats with them once a week for around 6 weeks. So they're our lower level offers. And then we have our sort of more higher intensity. So we have our cognitive behavioral therapy treatment. So the higher intensity ones are all between 6 and 16 weeks of support, so all short term, but yeah, 6 and 16 weeks, all either remote, telephone, or Teams, so or virtual. We offer cognitive behavioural therapy, we offer counselling, usually offer that for depression. We offer couples counselling for depression, so if one or both partners have depression and the relationship's impacting that. We offer interpersonal therapy, which is around relationships. We offer EMDR, which is trauma, so trauma-based therapy, eye movement desensitization and reprocessing. Very long-winded, but we offer that.
EMDR, yeah, for sure.
And then what might be interesting to the pharmacist to also kind of plug in a way is our mindfulness courses. So we offer mindfulness specifically for health. So it's around how people can manage their pain and manage their symptoms through mindfulness. So how you kind of relax the body, connect the mind with the body. And they are 8-week, usually on Teams, but 8-week sessions. So using mindfulness. So even if people haven't got anxiety or depression particularly, but they're struggling with a long-term condition, something like that might really help them with that condition as well. But we also have mindfulness for like CBT based mindfulness, which is slightly different. But yeah, lots and lots of different types of therapy. And then additionally to that, I don't know if we'll carry on, we also have some add-on services. So we have employment support within the service that people can access. Yeah, we have Healthy Living, Healthy Minds, which is like around nutrition and diet. And then we also have resilience coaching, which is a new pilot for 18 to 25-year-olds in the city, and where they can support them to get out into the community. They can support them while they're going through therapy. So lots and lots of different options for people. I know that was a lot to take in, but yeah, that's what we offer.
Exactly as we started out by saying, I completely bowled over yesterday when I found out everything that you do, and I think there's so much there, and it's just all fantastic stuff. So many things to help so many different people, and I think it's interesting you talking, Martha, about the sort of the mindfulness, and how that can help with things, like longer term conditions or things like asthma, cardiovascular disease, that kind of things, for sort of calming people down. And what's the difference? What sort of difference do you see between sort of the digital stuff, Martha, and the face to face? Are you getting similar kind of effectiveness rates from
Yes,
them?
we do. And I think there's a bit of a misconception, and I think often it's the way that it's sold as a service. So people are often, I've been referred for counselling, is what kind of people say. From whatever. So people are expecting that kind of traditional sat in a room with a therapist kind of approach. So when sometimes people might get offered a webinar, they might see it as like a second class kind of offer. And that's not what they were expecting. So we want to dispel that myth a little bit. And actually we get really, really good recovery rates out of that, things like our webinars or our digital support. Actually you can get a lot more information and a lot more resources packed in when it's done in this way, and people can take that away. But additionally, if you do a webinar and it's not meeting your needs, you get reassessed at the end, and you can be kind of stepped up to get one of our different treatments or higher intensity treatments as well. But we do find that the webinars get really, really good results. So
brilliant. Yeah, no, I've sort of done a little bit of research myself around this for the charity that I work for, and we're getting some really good results from the online work, the counselling sessions that are done. So it's interesting you should say that. And I think just sticking a little bit with the managing long-term conditions, and I know Mike mentioned this at the start, obviously a lot of pharmacists are supporting people with long-term conditions. So how might pharmacists be able to help identify some of their patients that might benefit from talking therapies? I don't know, Kashmira, Martha, I don't know how you want to answer that one.
So, pharmacists have good relationships with their patients generally. They see them often when they're picking up their scripts and coming in to ask questions about different medications and side effects. So essentially, pharmacists are more trusted. They're like GPs in that way. We're all in the NHS, we're all in the field of health and well-being. So people trust their pharmacists. So and as you see people coming in and out of your business, you'll notice signs of distress, low mood, anxiety, and it's often a best point to kind of raise that. Are you coping? Are you struggling with your sleep? If you can see that somebody's exhausted, perhaps talk about condition do you have, and would your mental health be struggling as a result of that? And just kind of gently have a conversation around support for mental health. I think the pharmacist is in a really good position to be able to raise that, because you're obviously from a medical professional, and you're also trusted, so that makes you an easy person to approach. And you're also more available sometimes than GPs, and you have to make an appointment. For pharmacists, you can just pop in and talk about medications and side effects and so on.
Absolutely.
To add to that as well,
Yes,
sorry, I was just going to say, you know, long-term conditions and mental health do coincide massively. You know, you've got around 40% of people with depression or anxiety disorders have a long-term condition. You know, you're 4 times more likely to develop anxiety or depression if you have a long-term condition. Managing pain, managing symptoms, managing that situation is going to have a massive impact on your mental health.
Absolutely.
So I think it's quite a massive kind of joint approach, really. You know, if they're coming in for their physical health, often I think in the NHS as well, we see things very separately, and hopefully this kind of relationship will help to demystify that, and kind of, you know, if you've just been diagnosed with diabetes, or you're kind of suffering with breathing, it's going to cause an impact on you.
Absolutely.
And some of our lower level kind of treatments, I think, would be amazing for a lot of people with long-term conditions. So, you know, living with a long-term condition, the webinar, and managing your well-being, you don't have to be really depressed to access that. That's just, you know, something that you can access when you get diagnosed or you're struggling. So I think it's important that you kind of ask people the question, and, you know, how are you coping with this condition? How are you feeling?
Yeah.
And
as you say, pharmacists are having these conversations on a daily basis. And I guess our next, and I'm hoping you're going to give me some email addresses and website addresses here. How do pharmacists signpost their patients and customers to Talking Therapies? How do we reach you?
Well, it's really simple. We have 3 kind of portals where you can access information or refer yourself. We have our website, which is www.nots-talk.co.uk. And within that website, you can either self-refer, so you can put in a referral form yourself if you feel like you need some support. We also have what's called a professional referral, so the pharmacists can use that professional referral. Again, both forms are very similar. Most of it is contact information for the patient and a touch on medication, a touch on past treatment. And the professional referral allows a little bit of context from the pharmacist about what he may or she may know about the situation or the patient themselves. You submit that, and then we have our email where you can also refer yourself by email. That's nots.iapti@admin@nots-talk.co.uk. You can refer through that system as well. And there's a lot of older people who prefer a phone line referral system as well. So that's 0333 188 1060. So 3 ways of kind of contacting us and referring yourself.
Fantastic. We will put all those links at the end of this podcast. Definitely. Thank you. So, gosh, we've got a last, I think just the last salvo from Mike. I'm going to hand over and just maybe talk about the new medicine service again, Mike, because obviously Martha and Kashmir have talked about depression, anxiety, but also the long-term conditions that we're seeing on a daily basis in pharmacy. And it seems like, as you've just said, you know, we joined up approach here. That's the way to go. And I think, you know, pharmacists can be having these conversations, Mike, can't they? Sooner rather than later, really. Now we know about Talking Therapies. There's nothing stopping us.
Yeah, well, absolutely. I think Martha's point was absolutely right. Everything comes to bear in one conversation in a pharmacy. And the other thing Martha's absolutely right about, when you perhaps go and see a GP, you can only go in and talk about one thing. However, here, it might be that the pharmacist is having a conversation with a newly diagnosed diabetic who is who may not be taking that particularly well, and in that conversation they might discern that actually this person could do with a little bit more help, not the clinical help in terms of dealing with your diabetes as such, but it's the other aspects of dealing with these long-term conditions. And I was reflecting on, and I know you're a sportswoman as well, Kirsten, but I was reflecting on a knee problem I had 18 months ago, and and I'm normally a positive person, but actually, because it wasn't getting sorted out, it was really difficult because I couldn't go to the gym, I couldn't do all that sort of stuff, and my mood did dip. There is no question about that.
Yep.
And I found myself losing purpose. So why, and I knew where that could lead. So I think this covers the beauty about working with talking therapies is it covers so many areas, and what we've been trying to do in this podcast is give our community pharmacists an extra tool in their toolbox. So they go into a conversation with another tool on their tool belt. They are aware of this great help and support that's out there, and then they can talk into a situation which may not be related to mental health, but do it easily.
Yes.
And I think it's good to add there as well, Mike, that we're going to be working together to make sure all of the pharmacies are resourced. So we're going to be making sure that you've got posters that you can put up, and then you've got the wallet cards as well, so that you're able to give those out. They'll have QR codes on them. And again, in terms of the professional, just to add to what Kashmir is saying, there's just a little tab at the top of the screen. It says for professionals. You click on it, it says refer now. So just to add that in, so it's show how easy it is to kind of refer. But you will be expecting those coming through the post. So now hopefully you'll know what they're all about.
Oh, that's brilliant. Well, hopefully we'll be able to distribute those amongst community pharmacies, Mike, at some point in the near future.
That's the plan.
So watch out for that pack, I think, is the comment. Is there anything that anybody would like to add? I'm very conscious that there's a whole load of information here, and I know people kind of go, oh, I meant to say this, or have we covered everything?
Have we?
Yeah,
We've covered everything. There might be one other thing to add. We've got two, as we call them, priority referral pathways. So certain cohorts of people in the community have expedited access to our treatment. One of those is our perinatal pathway. So anyone who's had a baby in the last 2 years or is currently pregnant can access that pathway if they're struggling with their mental health as a result of the pregnancy. Also, their partner, their caregiver, if they are struggling with their mental health as a result of the pregnancy, they can have quicker access to treatment as well. They just raise that in their assessment with us. And the other kind of priority pathway we have is our military veterans pathway. So anyone who's served in the services, they're struggling with their mental health, they can raise that in their assessment, and they will also have quicker access.
Oh, that's great to add, Kashmira. Thank you for that. Very relevant for lots of people, I think. Mike, anything to add?
Well, yes, just a couple of things really. I'm personally very excited about this collaborative approach.
Yeah, me too.
It's because I think it can really help patients, and it can help pharmacists help their patients better and actually develop longer term personal relationships with those patients.
Exactly.
So I think there's a huge opportunity here, and actually it is exactly what the 10-year plan is designed to do. Healthcare professionals working together collectively for better outcomes for patients, which is magnificent.
Yes.
I think I just wanted to underline the fact that these services are free as well. So I think that's
a very good point. Yeah.
Really important to know.
Yeah.
Yes, we're not trying to sell anybody anything here.
Nope.
And it's also very much the start of this collaborative working. And we're looking forward to working with Martha and Kashmir about this. And as Martha rightly said, what will be happening in the near future, we're trying to get through flu first, actually, which I think is the right thing to do. But in the near future, every pharmacy will receive a poster, some leaflets, some cards, which they can then help and have a conversation with their patients with. And they'll be available. They can be available in the consultation room, and we'll give people the wherewithal to order more of those in future if they need them. Yeah. So very much the start of the journey. We're all looking forward to it. And I would say as well to anybody listening, if you have any feedback, any questions, please do not hesitate to either phone me, text me, or email me. My details, Mike Jones, are on the website, local pharmaceutical committee website. So, yeah, marvelous. Thank you.
Yeah, absolutely. Thank you all very much, particularly Martha and Kashmira for sparing your time. We really, really appreciate it. It's great to have you on, and I think it would be good to do some sort of follow-up podcast as well in the future, or maybe some webinars with you as well, for pharmacists. I think that would be great. As Mike said, this is the start of the journey, and we are all about collaborative working at Community Pharmacy Nottinghamshire. Absolutely. So many thanks. Really appreciate it. And thank you everybody for listening, and we'll see you all, or we'll hear you all again very soon. Take care. Bye bye.
Thank you. Bye.
Thank you.